Hello, my name is Zahara, and this is my spring presentation for the class of 2024, which I have a stroke patient. Reason for selecting the patient was a very scary case. She gave birth, and the birth had put her in the position that she was in. Interesting in knowing more about her disease state, hoping she gets better, and anyone in the hospital. We have to pray for our patients and everyone in the hospital. That's part of medical health, everything. So the brief summary was a 32-year-old, roughly 14 days of postpartum. She had a C-section. She had complicated by preeclampsia and presenting in acute onset headache. She presented to the site with onset headaches and right side weakness. So they had took imaging, which revealed she had roughly 25 cc left parietal intracranial hemorrhage without signs of aneurysm. So there was a discussion. So they had discussed with the doctors and nurses and respiratory therapists. We had to have a potential open surgical interventions given size and location of the hemorrhage. So the disease state. So her principal problem is the intrapulmonary hemorrhage of brain, and her active problem is stroke-like symptoms. Her temperature, so this is the vital signs. Her temperature 36.9, pulse 65, heart rate 18, blood pressure 100/78. So on that day I was in the neuro ICU. What I have realized about the neuro ICU, their blood pressure tends to run very high. So we have to be very careful once suctioning the patient because their blood pressure is already high. But with this neuro patient, her blood pressure was tend to be normal, which is 100/78. Her saturations was 100, heart rate was 65, and her BMI was 38. She was kind of overweight. So this is her AVG results. Her pH was normal, 7.45. Her CO2 was normal, 37. Her O2, so she had an oxygenation problem. Her oxygenation was 127. So they probably had to titrate the O2 down. Her bicarb was 26. Her base access was 1.8. Her oxygen saturation was 100. So yeah, so her oxygen saturation was 100 during that time. So they did her. That means her O2 was very, very high. So this is her vent settings. Her height 157.5, weight 208, mode PRVC, oral size was 7, PEEP 5, tidal volume 400, and respiratory was 18. Her FiO2 when I was in the room during that day was 40%. So that means they did titrate the O2 down. They got to do that, which is a good sign. So this is just some general information. She was admitted on March 11th. Secretions were thick and yellow. Patient was intubated on the same day, which was March 11th. 2/7, 23 at the lip. She was sensitive when she had suctioned her. So her heart rate would drop fast. So when we would suction her heart rate would drop so low. She was very sensitive to suctioning. So imaging, her ET2 side was well positioned. She had a normal heart size. She had no consolidation, no pulmonary edema, no pulmonary effusion, or pneumothorax. She had a CT scan, large left frontal intrahemorrhage measuring 4.8 times 3.725 with surrounding vasogenic edema and approximately 4 mm of left to right midshift. So she had a midline shift. Hemorrhage extends into the left lateral ventricle and third ventricle. This is her medications. The labs: sodium level 142, potassium 3.2, chloride 107, carbon dioxide 19, glucose level 104, Indian gap 13. This is her hematocrit was low, which was 35, hemoglobin 11.7, red blood cells looking normal, white blood cells normal 7.2, platelets 28.9, mean platelets volume 10.2, a cholesterol total was 219. This is some research I did. Women who are pregnant and have blood pressure can have preeclampsia. Preeclampsia begins 20 weeks prior to pregnancy. We have to have intracranial hemorrhage quickly, or it can cause brain damage. We have to treat it very quickly. This is the care plan. So we had took her to a transfer CT on her head and brain. to see if like everything's going all right. So we did a transfer, and I found it cool that that hospital had like new transfers, type of oxygen, transfer oxygen thing, tank, and to keep close monitoring, we had to. So we are trying. The care plan is to try weaning her off. We haven't weaned her off when I was there, and we have to keep educating the family. There were family on bedside. So these are some questions that what can cause her to have a stroke, and what is the intracranial hemorrhage in the brain. So blood pressure and bleeding in the brain, and it's caused mainly by hypertension. And this was supposed to be for the class. Congratulations, we did it. And this is my works cited.